So here's the thing. In our amazing, boundless, and hyper-connected world, everything has gotten better in the last few years. Easier, faster, more personalized, more convenient. But for many people, healthcare, and specifically health insurance, has gotten worse, more complex, more expensive, and it's taking a toll on the industry's perception. In the 2015 American Consumer Satisfaction Index, health insurance slid to the bottom of the industry rankings, scoring worse than airlines and barely ahead of the Postal Service and cable companies. And that's a problem for health insurers and health insurance marketers. Of course, it's also an opportunity, a huge opportunity, to be the health insurer that will better meet the needs and expectations of today's consumers. Let's explain. As everyone knows, the ACA and the many changes it triggered had a profound impact on health insurance. Lots of people now shop for, buy, and manage their own health plans on health exchanges. Their monthly premiums are not cheap, and most plans come with big deductibles, co-insurance, and out-of-pocket maxes. People are paying more for healthcare with more of their own money. That's one reason why 1 of every 3 exchange consumers switched health plans for 2015. And consumers who are covered by their employer's health insurance are facing their own changes because most of them have left the co-pay comfort zone and now have big deductibles of their own. Some have narrow provider networks to navigate, formularies to figure out, HSAs, HRAs, and FSAs to keep track of. It's been a huge change for almost everybody, almost overnight. We can call it consumer-driven, but in the eyes of consumers, it's mostly just complicated and costly. Look, we get it. This isn't health insurers' fault. They're getting squeezed and pushed on all sides. State and federal regulations, declining reimbursements, rising costs of care, etc. But it is their reality, and it's just half the story. You see, while all this was happening in healthcare, everything else got better, faster, and easier. Want to deposit that check from Aunt Susie? Snap a pic with your phone, and boom, it's deposited. Forgot your boarding pass? No, you didn't. It's there on your phone. Want to save a few bucks on lunch? Your tablet is searching for geo-targeted deals right now. Want to know how many miles you ran Tuesday? What song's playing in that movie trailer that makes you cry every single time? Directions, suggestions, your music, your photos, your accounts, it's all there, all the time. And here's the thing, it's no longer amazing to today's consumers. It's normal, it's expected. And when it doesn't work, it's not a disappointment, it's a disaster. These same consumers have also been empowered to express themselves. Not happy with your waiter? 1-star review. Annoyed by the checkout line? Tweet it to your gazillion followers. Today's consumers can share and compare opinions like never before and are holding brands and products more accountable. So, on one side, we have these empowered consumers who expect their banks, grocery stores, dry cleaners, and everyone to make things easier and better. And on the other side, you have health insurance. But here's the good news. The path right now is clear for insurers who innovate, who will make the experience of health insurance truly better and easier, more mobile, more accessible, and transparent. For instance, during enrollment, are there ways to increase personalization, such as custom member portals or the ability to choose a la carte extras, like upgraded wellness or lower copays for certain services? For employers, are you offering better ways to satisfy employees, such as private exchanges? At the onboarding stage, can you make it easier for new members to start using their benefits and accounts and hopefully make a great first impression, not just send a pile of stuff? Is everything online, integrated, mobile optimized, and jargon-free? How about providing tools and apps that help members become better, more informed healthcare shoppers, to compare costs and patient reviews for different providers? Better still, how about providing a concierge service to help with the shopping process? Or how about offering customer service round the clock by phone, video, or chat? or hosting online member communities where members can share advice peer-to-peer, or working with providers to offer the convenience of telemedicine, giving members 24/7 access to doctors via phone and video chat, or incorporating mobile-enabled devices that monitor chronic conditions, or even more basic, how can you transition current members away from paper and toward the convenience of digital communications, which could save you millions of dollars per year? And what about providing a better way for people to manage their health records? And what about... Well, you get the idea, because there are lots of great ideas. It's time to start seeing health insurance through the eyes and expectations of the modern healthcare consumer, because the opportunity for growth, retention, and real marketing buzz is there for the health insurers who do it soon and do it well.